Over the last 24 hours, we have identified 1,510 new cases and completed about 13,800 tests. Our positivity rate was 11%. Currently, 679 people are admitted to hospital for COVID-19, including 154 in the ICU. Sadly, I must also announce that 9 new deaths were reported to Alberta Health in the last 24 hours. My thoughts go to the family and friends of these individuals and anyone mourning a loss. We have seen many more deaths recently, which reinforces how seriously we need to take the current situation. It is to prevent outcomes like these that immunizations are so important. I know there has been concern lately, noting that some of our deaths have been in people who are fully immunized, and I want to be clear that vaccines are still making a profound difference. Vaccines, like all other medical interventions, are not perfect. What they can offer, however, is a high level of protection against infection and an even higher level of protection against severe outcomes. In the last 4 months, 84% of all those who died from COVID-19 have not been fully immunized. Unfortunately, we are seeing a small number of breakthrough infections in those who have been fully immunized, and some of these people have gone on to have severe outcomes, including death. The majority of these severe outcomes have been in those who are older, have multiple medical conditions, and this is why we have implemented a third dose for those with immune-compromising conditions and for all residents in seniors' continuing care facilities. Even without a booster dose, however, vaccines are still very powerful. In the past 2 months, no fully vaccinated Albertan under the age of 60 has died. For those 60 and over, Albertans who don't have the protection of 2 doses of a vaccine have a 14 times greater risk of dying from COVID than those who are fully immunized. In addition, looking at our current ICU and non-ICU hospitalizations, 91% of those in the ICU are not fully immunized, and 75% of those in hospital outside the ICU are not fully immunized.
This afternoon, our ICU capacity is at 87% of all our capacity, including the surge capacity that we have created to date. There are 231 people in ICU. About 70% of these patients have COVID. In the past 7 days, we have added an additional 59 surge beds. We now have a total of 93 surge beds above our baseline of 173 ICU beds. So although we state that we are looking at a current capacity of 87%, remember that this includes surge beds. If we did not create the surge beds, we would be at over 130% capacity.
So it's clear from our data that, again, the highest transmission rates are in those who are younger, which isn't their fault. This is an age group and a demographic that typically part of that developmental process through adulthood is spending time with friends, socializing. So this is not to blame those individuals, but to indicate that clearly that particular demographic and that younger adult age group is a huge part of what's driving transmission right now. We know that the places where transmission likelihood is highest are indoor spaces that have many people together, that are not masked, that are participating in activities such as dancing, so thinking about a nightclub where people are in close proximity, that we know that as people use alcohol, they become more disinhibited. And so what we saw previously in previous waves was that while people may try to follow certain measures or restrictions or spacing earlier on, that becomes less and less likely later on as people have been drinking and are less likely to be prioritizing those COVID precautions. So we looked at the experience of other countries as well as our own, and what we know about COVID transmission, which is that these types of settings where we have large numbers of people in the demographic that are at the highest current driving group for the transmission of COVID-19 in the province, where you have many people together in close proximity, using alcohol and disinhibited is a concern. And again, this is one measure that we can take to minimize those kinds of interactions, as well as, again, mandatory masking and reminding Albertans that We're in a very challenging time, and we all know, every one of us knows what we've needed to do throughout the last year and a half. And so all of us know that staying home when sick, making sure that if we're in a public place, we're wearing masks, staying distance from others outside our household, those are basic things that all of us can do. This one additional step was added to that list of measures to, again, minimize the risk in some of these very high-risk establishments.